Tarun.
Yes.
Hi Tarun, it's Dr. Anitha here. Your question is why women gain their weight after pregnancy. See, during pregnancy, gaining weight everybody knows, but after pregnancy, also some majority of the time, weight gain is because of multiple reasons. Many of the postpartum changes after delivery will usually happen within 6 to 8 weeks of pregnancy. That is, they tend to lose the weight immediately after delivery. But later on, if there is lack of physical activity, sedentary lifestyle, dietary forms are not correct and appropriate, may indirectly put the women on weight gain. Majority of our women after delivery are succumb to give lot of rest, but this is actually not the way it has to be. Rest, yes, mentally she needs rest, but physical modulations in the form of right form of the diet, at the same time exercises, certain exercises particularly related to the diet forms are basically your pelvic floor exercises, abdominal exercises, etc. Even the diet forms, there are a lot of myths in the modern era. The myths has to be overcome by now because these myths cannot be followed in modern era. The reason is that there are many dietary forms which are not actually entertained in the postpartum period for majority of the mothers, but that is not correct. Restricting with proteins, enhancing with a lot of fatty foods, sedentary lifestyle will metabolize all your fats and indirectly increase the weight. Along with this, if a woman is not breastfeeding, taking high calorie foods, processed foods again will cause weight gain. Women who have pre-medical problems, like already she's morbidly obese or diabetic or thyroid or hypertensive, again they don't lose their weight. It is not because of the post-delivery weight gain, because of all these which is not focused into the weight which has to lose schematically may not be able to lose in a systematic way. And majority of them even forget that after 6 months, 1 year, 2 year also they're supposed to have a physical activity in the form of exercises. This is because of the notion of that giving not less importance to the health factor, especially to exercises postpartum. So postpartum exercises, physical activity and diet are very, very important, which shouldn't be neglected. And Roshini, your question is, are irregular periods always a sign of hormonal problems? Irregular periods may not be always the sign of hormonal problems, but it is indirectly telling that there may be succumb to multiple factors. Commonly, when irregular periods are there in a young individual, it is because of a condition called as PCOS. Now it is termed as PMOS. It is no more PCOS. So this is one myth which has been crossed up because PMOS is a metabolic disorder. In sum up, to explain and analyzing that, it is came to know that it is a metabolic disorder in toto, which includes here are significant hormonal changes resulting in irregular periods. But given apart, if a woman is having a regular cycles since the beginning and having a regular periods and attending of her first period on time, her diet and lifestyles are pretty good. Most of them will have regular periods. But if any of these modulations happen, they are succumb to having irregular periods in the form of what lifestyle are we having now? We are extremely having a disturbed lifestyle. A lot of stress factors, our food habits have changed, excess of exposure and late night sleeping hours. This all indirectly impact your hormones, which has to cause your irregular periods. Irregular periods is not only because of the hormone production, the hormone problems is indirectly stimulated because of our change in the lifestyle. Second, it could be your medication, it could be your stress factor, it could be your dietary forms, it could be the way of your lifestyle. It is not just putting one point that it is because of the hormonal problem. If the natural rhythm, circadian rhythm are disturbed, that indirectly imbalances the hormones in the body of a woman, due to which the hormonal problems are addressed to. Third question is, take my laptop. why nowadays most of the females are having PCOS or PCOD? What might be the reason? Again, I told you the same reason. Many of us in nowadays generation, we have a very disturbed lifestyle. Majority of us are super duper advanced, but yes, we are missing a basic life, healthy lifestyle habits. For example, how many of us will do exercises every day? The proportion of percentage of people may not be even 50%. If a second question I ask that how many of you can withhold any kind of junk foods for 15 days, forget about 15 days, at least for a week, that is also gone. How many of you can leave your gadgets aside and sleep on time, 10 o'clock? No, our sleep cycle has shifted to 2 a.m. in the morning, 4 a.m. in the morning. Fifth, how many of you know there is a routine activity that our system also need a physical activity and exercises regularly, and that has to be focused seriously? That is also not there. So the way we are eating, the food habits, our stress factors, our modern lifestyle is seriously impacting majority of the generation, especially younger adolescent generation, with this condition known as PCOS, which is now called it as PMOS. It is a polymetabolic disorder, not one disorder. It means our circadian rhythm lifestyle changing. It is impacting every part of the system, more so for a woman with irregular periods. Uh, Next is, what are the early signs of hormonal imbalance? I think today is an hormonal imbalance day or PCOS day. Maybe this was given the topic where most of you are concerned. This questions about what are the early signs of hormonal imbalance. More than early signs, I want to tell all of you that by the time the early signs come up, you have really impacted your internal environment years before the early signs come up. So don't wait for the signs to come up. It means whatever I told you, the point, the lifestyle, the diet, the physical activity, and regular sleep cycle, it's very important, because this impact will not come in months or days. It will come only after years. By the time it impact, your reversal back is very difficult. So what are the common early signs of hormonal imbalance? For a woman, you will get irregular periods. That's the first thing where every woman will come to the OPD visiting, ma'am, my periods are not coming regularly. Second, my period flow has reduced, or the quantity as flow has reduced. Third, I'm having lot of hair fall, I'm getting pimples on my face, I'm gaining weight. That is a typical impact of the hormones, which has disturbed not in weeks or months, years. So it is an alarming for us to alert and become serious on this note and get it immediately rectified. Otherwise, this become a chronic impact on the health, causing significant medical problems in the form of hypertension, diabetes, future on obesity-related problems, infertility, conception issues, pregnancy complications. Morbidly obesity causes a lot of sleep cycle disturbances and mood variations, and stress factors will aggravate all this in total. How important are routine women health check? A very wonderful question. Who has asked this? Really good question asked. It is as important as you guys have a phone in your hand in this generation. Can anybody live without the phone in your hand? Tell me one person in this world who doesn't have phone in their hand. Getting the health check is very important. Many of our women have a very strong myth is that they feel if a blood test is normal, if a sugar is normal, if the ECG and X-ray is normal, she is healthy. No. For a woman health, it is very important to understand that especially reproductive organ health, your uterus, the cervix, and the breast examination and health concerns to these are very important. More than 60 to 70% of the women suffer with this, neglecting this aside, thinking that I'm normal because my blood results are normal, my X-ray is normal, my ECG is normal. Annual pap smears, getting yourself checked up with your mammography or breast examination, coming to your gynecologist, addressing your gynec issues, checking whether the uterus, ovaries are fine. It's equally important than just a blood test. Many of the conditions are missed by the time they become a full blown dangerous situation to rectify. They silently have problems like especially ovarian diseases which may not come out showing any symptoms and suddenly can come up with a severe pain abdomen or a bloating. So similarly, pap smears are important test for every woman to undergo for a cervical cancer screening. This is the second most leading cause of death in our women population till today in India. We have given awareness lot regarding this at the same time to vaccinate young adolescents with HPV vaccine, the only preventable vaccine for cervical cancer. Any strong family history of breast cancer, please come for your screening early by 35 years. Do monthly breast examination. If you have any queries and concerns, how to do it, we are there to help you. You can visit us. Next question is, what's the reason of getting the cervical cancer nowadays? It is not a nowadays. I don't know who asked this question. By the way, Sneha. Cervical cancer is, as I told you, the second most common cancer which is there today in India. It is the reason is many of our women hesitate to come with any gynecological issue, especially our mothers, aunts who have inhibition to come and tell their personal problems. They are not aware how important is a gynec checkups to rule out and rectify these important cancer findings before they become obvious or evident or advanced in stage. Gynec examination, gynec checkups, and cancer screening for cervix is very important to identify this on an early note, provided they come to us on time. Important to understand if you have an excess of white discharge, if you have any foul smelling discharge, if you have blood in between your periods or a postcoital bleeding, they're a very important sign. You have to come and meet us immediately to address any kind of your cervix issues and to identify the causes. The cancer risk is there now because we are promoting the HPV vaccine. Coming up era, maybe the incidence may reduce it, but still a bigger population era is our middle-aged women who are lacking this. We encourage all sexually active girls, girls who are between 9 years to for 12 years to get vaccinated, reproductive age women to come for annual pap smears till 65 years. Can PCOS be completely cured or is it only manageable? So I'll recorrect again today. It is called as PMOS, not PCOS. Now, metabolic complex disorder can be correctable provided the correctable treatment of this when given to you will be sustainable. Many of them, they start the treatment with enthusiasm, doing the diet strictly for 3 months and they let go. Second, the advice given to you related to your medications or your lifestyle and your dietary habits will never be focused into a long term way. It means lifelong. The moment you leave this, the existing hormonal imbalance, how can it be correctable? These conditions needs a very regular, rhythmic and discipline. If it is not done so, the circadian rhythm or the hormonal imbalance will go back again and you'll come back with the symptoms. The enthusiasm with what we start up with may not sustain even for months or years together and you let go. So these are metabolic problems similar to diabetic and hypertension where your regular medications, regular treatment, regular follow will help you to keep them under balance. Do PCOS lead to endometrial cancer? PCOS we have so-called now as PMOS. It is a multiple metabolic disorder. we have a categories of patients where a lean patient, obese patient, a moderately obese patient, anybody can have PCOS. Patients who have very high risk for obesity, high BMI, family history of diabetic hypertension, and metabolic disorder in the form of hyperlipidemia, insulin resistance, high cholesterol levels are very high risk for endometrial cancers associated with PMOS. How can we treat shorter period cycle? Right. Normally, when a woman starts getting a periods, it is generally between the age group of 12 to 16. This was the thing which we were thinking about. But now, even 10 years is considered as a normal age of onset of first periods. And every period onset has a variation of onset of age. At the same time, every month, there is a rhythm of having the regular cycle. 28 to 35 days range is considered as normal. Any woman who is having a regular cycle with a rhythm of 28 days, it is normal for her. A woman who is having 35 days, it is normal for her. But given apart, there are certain population of women who can have 25 days cycle, 23 days cycle. These cycles, if they have been there regularly since the onset of the periods and it is continuing the same way, it is your physiological response to your hormonal balance and it will be the same cycles for you. That's called a short cycle, 21 to 26 days. It will not harm you in any way. Do we have to treat them? Not always mandatory to treat, because this is your natural hormone circadian rhythm in the body which is releasing. If these short cycle periods are really causing you any troubleshoots in the form of heavy bleeding, more frequent cycles in the form of 15 days once, it means there is some issues which has to be looked into. So you need to consult your doctor, finding out whether you have a thyroid issue, you have your PCOS, any problem in the uterus, any polyps or cyst in the ovary, etc., to identify why this hormonal imbalance causing shorter cycles of periods or kind of heavy periods associated with shorter cycles. So it needs to be evaluated, but not all short cycle periods requires treatment. Any doubts, you can always ask the question here. Welcome, Pratibha. How can we treat shorter cycles? This is your question. Yes, welcome, Pratibha. If it is normal for you, please don't bother about it. Have a healthy lifestyle. That is more than enough. 21 to 26 day cycle is absolutely fair enough. If any troubleshoots, only we'll address you accordingly. Welcome, dear. We are left with five more minutes. We'll take some more questions in 5 minutes to address your concerns. Why are women struggling to conceive these days? I know these days it has become such a challenge, not only getting jobs has become difficult, but also conceiving is also becoming difficult. So, given apart, thing is that our lifestyle has impacted us so much. So, something called as biological clock. I'll take another 3 minutes to address this if no more questions on the forum. There is in a woman, we have our career cycle and a biological cycle going hand in hand. So now there is a shift and a drift in our plan of pregnancies, and due to which our biological cycle is been the same, but our shift towards our pregnancy planning is changing and changing. Initially, it was somewhere between 20 to 25, but now even after 35, we are in our career plan. It is not really wrong. It is, yes, it is very good. You have to have your passion, but in the physiological way, our women have regular periods, regular cycle, and reserved number of eggs. After 35, the volume of the eggs in the ovary reduces, and after 40, there will be a significant drop in the volume of the eggs in the ovary. Second is that the lifestyle what we are having. The lifestyle has become really stressful, non-rhythmic, due to which our hormones are getting impacted so much that we are not even getting our regular cycles on time and impacting with our ovulation cycle. If you have a regular cycle, it will help you to have a regular egg growth and egg release, and you will have a fertile period or a fruitful zone to conceive. But the second impact. Third impact, so much of food habits, packed food, these are called as endocrine disruptors. If you can just go to your Google and type and see, endocrine disruptors is becoming exuberantly one of the ways where entire our internal environment is getting drastically impacted because of the external environmental factors like consumption of preserved food, artificial food, processed foods, etc. And fourth is lack of exercises and physical activity, which again causes your hormone turmoil and again will impact your periods, which indirectly cause you difficulty in conceiving. And last but not the least, there's a condition known as endometriosis, which is the hidden condition, a painful condition where majority of the women suffer with severe progressive pain, a pain which cannot be understood, a pain cannot be explained, but yet you suffer silently. In this condition, 50% of the women suffer with fertility issues, and you have to meet your expert endocrine endometriosis specialist to address your problem on this before your pregnancy chances and planner become really havoc to conceive. We have another 2 minutes to go. Any more questions? We'll take the questions and we'll answer. Drop your questions here. We will try make the video on that topic, and you can subscribe more to our health channels. Frequently we'll be addressing on this very specific topic as well. So we have 5 more minutes to go. No, 2 more minutes to go. Any questions? We'll be happy to discuss on this forum. Thank you all.